We are pleased to be joined by Dr. Keith Libou, who is Chief Clinical Officer, Delta Dental of New Jersey. Good to see you.
Thanks, Dave. Great to be here.
Let's talk a little bit about, when we talk to some of your colleagues, people say, I'm going to the dentist and I'm going to get my teeth checked. I'm going to take care of some of my teeth. But oral health is so much more than that. You've told our producers, hey, wait a minute, we have to look at your full medical history. This is about something bigger than just your teeth.
Absolutely. It used to be a situation where somebody would go to the dentist and the dentist would still take a full medical history, but the primary reason was really to be able to provide dental care safely. If you think about it, it's one of the few medical areas where virtually every visit is an invasive procedure. Because something is happening, there's an opportunity to introduce bacteria into the body, and we use anesthetics. And so we want to make sure people can be treated safely. Now, what that's evolving to is really a situation where dentists are really becoming a primary care provider.
Really?
For patients, absolutely.
A primary care provider? Give us an example.
Well, for example, you know, a lot of patients, there are millions of patients that see their dentist annually, whether it's for routine care or an emergency, who do not see a physician regularly. So the patient goes in to see see their dentist. They haven't seen a physician,
right?
And the dentist has an opportunity. I like to call it an at-bat, but they have an opportunity to do a number of things. They could take the patient's blood pressure. They could evaluate the patient's family history for diabetes and do a risk assessment. They could evaluate whether or not they're at risk for sleep apnea. And something that's really, really exciting, back in early 2015, the state of New Jersey Dental Board was very progressive, and they actually stated that it's within the scope of dental practice for dentists to actually do in-office blood testing for diabetes.
For diabetes?
For diabetes.
The dentist would do that?
The dentist can do it.
Can do that.
Absolutely.
Are a significant number of them, doctor, doing that?
No.
Should they be?
Well, there's definitely an opportunity to do it for patients that have risk factors for diabetes. As a matter of fact,
that's why the full medical history matters.
Absolutely. Right. And sometimes it's not in the medical history. You know, for the most part, it's going to be people that don't have an indication that they have diabetes, but when you look at their how they appear physically, their family history,
right.
Sometimes patients have a certain pattern of periodontal disease, uncontrolled periodontal disease, where you look at them, and even that could be very suspicious of somebody having diabetes, because there is this relationship between diabetes and periodontal disease.
You know, as I listen to you, doctor, it's so clear to me, and I have this particular relationship with my dentist. They do play a bigger and bigger role in our overall health care. Is it changing the way dentists are being trained and their role in society?
Definitely. There is a very much more of a medical orientation to the way dentists are being trained, both while they're in dental school, if they're doing residencies in hospitals afterwards, but they are, they're coming out there, they're diagnosticians, they're very well skilled in understanding how systemic issues present orally and the risks, the risks of certain oral conditions, systemic conditions, in terms of being able to provide safe dental care.
Let's talk about this. And by the way, the Delta Dental of New Jersey Foundation has been incredibly supportive of a whole range of public awareness efforts, and public television, the Caucus Educational Corporation, has been doing public awareness of oral health through some of that support. But I also want to be clear that one of the really terrific organizations, the Zufall Health Organization, has recently received a grant from the foundation for, is it a mobile health van, is it?
It's actually a fully equipped 2-chair mobile dental unit. And
what does it do?
It actually can provide comprehensive dental care for Zufall patients who don't have access to transportation to get to one of their physical sites. so they could reach out and extend the reach and the scope of care they could provide to people who otherwise wouldn't have access to dental care. It's
So you're
really
going
wonderful.
to them, sorry for interrupting, you go to them as opposed to saying, okay, you should be going to a dentist to get this done, you go out to find them.
Exactly, exactly. And
Is that particularly in urban areas? Let's talk about the urban areas, because I know there's a Rutgers connection as well.
I know one of the primary uses for the mobile unit is actually going to be going out more to the rural areas where there are transportation issues.
Sure.
There is actually Sioux Falls has a number of urban-based locations, so I think the mobile unit specifically is probably more focused towards people that are in the more outlying areas where they don't have access to transportation.
But you have helped in urban areas as well. The ACA, the Affordable Care Act, and dentistry, be more specific, how has it helped children with respect to their oral health?
That's interesting. When we look at the people who enrolled in ACA-related dental coverage in the state, there was a significant enrollment. The surprising thing we saw, out of all the people enrolled in the exchange or off-exchange related programs, only about 10% of them were children. About 90% of them were adults. But it still does provide access to kids for comprehensive dental care coverage who otherwise wouldn't have had it. So it's really tremendous that way.
So it's helped in that way.
Definitely.
Dr. Keith Libou, who is Chief Clinical Officer, Delta Dental of New Jersey. It's so interesting. People say, I'm going to my dentist to take care of something in my teeth or my gums. You made an important point, and you're making it clear that this is overall health, and dentists are playing a more important role than ever before in our health overall. Thank you, doctor, for teaching us. We appreciate it. Thank you so much.